The first thing that we noticed with Georgia here is every time she swallowed, she had what we call a reverse swallow, which means every time, and you can see it right there.
Yeah.
That means every time she swallows, that muscle under that lower lip is contracting, and that's pushing back on that lower jaw. Yeah. So when we look on this at the side shot here, you can see that lower lip and that chin are a little bit backwards to that upper lip there. Can you see that? Can you see that, Georgia? Yep. So the reason why that lower jaw has been limited in its development is because of that swallow there. So Georgia, when you swallow, your face should be still. There shouldn't be any movement around there. And the fact that there is movement under that lower lip means that that lower jaw hasn't been allowed to develop forwards as it should. Yeah.
So is that anything that she's done, or is that just just the way?
Well, basically, the reason why that's happened is normally with our modern westernized diets, our muscles aren't developed as we should. So the chewing muscles should be really well developed. And when we have our chewing muscles well developed, then we have our swallowing muscles well developed. Yeah. So we should be swallowing with our chewing muscles.
Yes.
Yeah.
That makes sense.
So when we don't have our primitive fibrous hard diets, then we develop bad swallows. So we recruit these facial muscles to swallow, and that's what causes crooked teeth, basically, in a nutshell. Yeah, it is interesting, isn't it? Yeah.
Makes a lot of sense.
It does, yeah.
Yes.
Yeah, good. So another thing we noticed here is Georgia's cheeks are just covering the side of her lips there. Can you see that?
Yeah.
So when we see that, we immediately think that we call these the buccinated muscles, and they're the blowing muscles. You know the muscles you use, Georgia, when you blow a balloon up? Those ones? Yeah. They're the ones. That's it. So they're actually what we call overactive. And when we look inside the mouth, now we'll show you actually, these are the molds we took of your teeth last time, Georgia. The first thing we can notice here is, see at the back, those upper teeth are behind those lower teeth there.
Yes.
And that's all caused by when Georgia swallows, not only is the muscle contracting under that lower lip, but also those blowing muscles are contracting and pushing and narrowing that upper jaw.
Okay.
Yeah?
Yeah.
So they're pushing in, and it's both the left and the right. So on the right, that upper tooth is behind the lower tooth, and on the left, the upper tooth is also behind that lower tooth there. And when we look again inside the mouth here, on the side, now it's not too significant in Georgia, but she's got what we call an overbite and an overjet. So an overbite is the vertical overlap of the front teeth, and an overjet is the horizontal discrepancy between those front teeth there. Okay. And what's normal when they have just baby teeth is for those teeth to be edge to edge, so right on top of each other.
Yeah.
Now, that again is due to that reverse swallow there.
Yeah.
So that lower jaw hasn't been allowed to develop forwards as it should. Also, you can see the angle of those upper front teeth. Yeah. So that's a bit back. And that, again, you've got a question, Georgia?
Yeah.
Yes.
Why have I got hair on my chin?
Do you know what I noticed?
You know what? I know the answer to a lot of questions, but not that. No, I think that's pretty normal. Don't worry. That's very normal.
Does everyone have that?
Everyone does. Everyone does. Don't worry. So the reason why those top front teeth, Georgia, are tipped in like that is because of that lip. So that bottom lip, when Georgia swallows, that's also pushing back on those upper front teeth.
Okay.
Which is pushing the back. So it's all to do with swallowing those muscles under that lip. So this is Georgia's upper jaw here, and you can see there's a little bit of crowding, especially in the front section there.
Yeah.
And the reason why there's crowding there is because Georgia's tongue hasn't been in the roof of her mouth as it should all the time.
Because her first two teeth were her two bottom teeth.
Yeah.
And they both came out at the same time.
Yeah.
Crooked.
Yeah, right. There you go.
So,
yeah.
And she had nothing else in there.
No, that's right. That's right. It's
That's
a
why
muscle.
that one's going up crooked.
So that was based from her tongue.
Tongue and the surrounding muscles as well.
Okay.
Yeah, that's right. So the fact that the tongue hasn't been up in the roof of the mouth has meant that those overactive cheek muscles have pushed those that upper jaw in and narrowed the jaw, and that's what causes the crowding. So the fact that the jaw is too narrow means that there's not enough room for those teeth to fit in straight. Does that make sense?
Yeah.
So what we're going to do here is make sure the tongue is taut to be in the right spot, which is in the roof of the mouth. Yes, Georgia?
Where does the tongue have to be?
Okay. Well, where do you reckon it has to be? Should it be in the bottom of your mouth or the top of your mouth? The bottom. Well, that's where it has been, but where it has to be is in the top of your mouth.
So it has to sit on the roof
That's
of
it.
your mouth.
And the best way to know where the tip of your tongue should be is to say N. Can you say N for me? N. Now see where the tip of your tongue finishes up? So the tip of your tongue should be just behind your top front teeth, just like that. And your lips should be together.
All the time?
All the time. Apart from when you're speaking or
Yes.
eating, obviously. I mean, you'd be especially talented if you could speak or eat when you have your tongue in the top of your mouth, but that's where your tongue should be at rest.
Wow.
We call it, yeah.
Okay.
Okay, so that's what the Myobrace does.
Naturally, do people normally have that?
Yes.
Naturally?
Yeah, normal. That is a normal position for the tongue, but more and more nowadays, I mean, we have about 90% of people in the Western world with crooked teeth.
Yes.
And the reason why we have that bad muscular action now is because, as I said, we have softer diets.
Yeah.
So our chewing muscles, which includes our tongue,
Yes.
haven't been developed
That makes
properly.
so much
Yeah,
sense.
yeah.
And considering when they're kids, you feed them mashed potato,
That's
and
right.
all the soft
All that
food,
stuff.
just
Exactly.
so it's easy
That's
to...
right. So what we're going to do about it is basically use Myobraces to
Yes.
start. So we're going to start off with a nice soft one. Do you want to have a hold of that, Georgia? Have a feel of that? So they all look a little bit different, but what's common to all of them is, first of all, this tag here. That's called the tongue tag.
Yeah.
And that tells the tip of the tongue where to sit. So Georgia, that's actually in the same place as the end spot
Don't
that
put it in your mouth.
that we were talking about before.
That's
yeah?
not yours.
That's right. So, and also, can I just grab that for a sec, please, Georgia? Thank you. So see these little bits down here?
Yeah.
They're going to act on that muscle under Georgia's lower lip.
Right.
So these extended bits will act on that, and that's going to control that for us. So
Okay.
simple concept, focusing on how the tongue's behaving,
Yes.
and then focusing on how those muscles under that lower lip are behaving as well. Make sense?
Yeah.
Yeah. So we basically progress through a range of these appliances. We start off with the soft.
In her mouth, as she grows,
Yeah.
does she grow out of them?
That's a very good question. We have different sizes.
Okay.
Now, these are pre-formed because we're not actually acting on the teeth. We don't want to target the teeth and the jaws as they are now.
Yeah.
We want to target the surrounding muscles.
Okay.
Yep. So we normally select ones that are bigger than her jaws and bigger than her arches.
Yes.
Yep. But yes, we do have some different sizes, and as they grow, we can move to bigger sizes.
Yeah.
So we start off with the softer one, we move on to a stiffer one, and we move on to a stiffer one again at the end. And then to align the teeth at the end, we have this one with little tooth slots there. So you can see that one.
Yes.
So that gives us the alignment. But often,
That's hard.
it's actually quite soft. It's the same softness as the other thing, but it just has this harder bit inside, which makes it a bit stiffer. Yeah? But it's very comfortable, very comfortable. Trust me.
Much more comfortable than wearing braces.
That's right, that's right.
What do braces feel like?
See those teeth right there?
Yeah.
It's braces.
Can be.
What did I feel like?
They're rough. Feel them.
That's right.
Can you feel
Do you
them?
want to have a feel of them?
Yeah. They're rough.
There you go,
They're
run your
metal.
finger over those.
Imagine trying to bite into an apple with that.
Oh, yeah.
Yeah.
Did you eat an apple when you had braces?
I'll put them.
Okay, so we'll just run through the treatment plan here.
Yeah.
So basically, your main concern was the crowded teeth.
Yes.
And the crowded teeth have been caused by those bad swallows and the fact that Georgia's tongue isn't in the right spot and not behaving correctly. And the arch form just means the size of those jaws. And we found that Georgia's jaws are, as I said, narrow and underdeveloped.
Yeah.
And she's got the overjet, which means the horizontal discrepancy between the front teeth. And the crossbite here means that bite there where the upper teeth are behind those lower teeth at the back there. Yeah. So we are going to start off with these, but we are also going to use what we call myolay. So
What's that?
that means basically just these little bits of filling material that we're going to pop on the top of these baby teeth down here.
Okay.
And that's basically to unlock the upper teeth from the lower teeth.
Okay.
Does that make sense? So
Yes.
the upper teeth are behind the lower teeth like this.
Yes.
By popping those little bits on the lower teeth, we're going to unlock the upper jaw from the lower.
Yeah.
And then we encourage the tongue to get up there, and that's going to expand the upper jaw.
So does that hurt to put them on or not?
No, not at all. It's basically just like glue sticking on top of the tooth. Yeah, very easy. But we also have these things up our sleeve in the future. Now, at George's age, at 6 years of age, normally the Myobraces are enough to get the job done.
Okay.
But we also have these things up our sleeve. So this is a plate to widen the upper jaw if we need it. We also have this wire that sits behind the upper teeth to widen the jaw again. But we'll cross that bridge when we come to it.
Do you think it'd be necessary for her to have that?
I don't think so at this stage, but it all depends on George's compliance. So if she wears the Myobraces as she should, then she'll get a great result, and we should be done within 2 years. 2 years.
But that's good then, sweetheart, because then that means you're done.
That's right.
There's no more other treatment that needs to happen.
And to be honest, especially with George's level of severity and at her age, a lot of our cases are done within the first year.
Okay.
So we say account for 2.
Yes.
But with good compliance, it could be done within the first year with George.
Okay.
Yeah.
And then there'd be no other need for anything else after that?
No, that's right. So we like to monitor her just like a regular dental checkup every 6 months until the permanent teeth come through. So around 12, 13. So every 6 months is a review period, so that if something does start to go back to where it was, then we can intervene without too much fuss or without a really dramatic intervention before the problem gets too bad. So, Georgia, it's not too much work really. When you think about it, you only wear it for 1 hour while you're awake, and the rest of it is while you're asleep. So it's really not that much effort when you think about it.
That's perfect.
And it doesn't need to be an hour at a stretch. I know we're all pretty busy these days, so if you're too busy to do 1 hour at a stretch, you can do half an hour and half an hour as well. So half an hour in the morning and half an hour at night. Whatever suits you guys. Yeah. Make sense?
It's perfect.
Yeah? Good. Okay. So in terms of the treatment, now Georgia might be a possible mouth breather. We noted. So
she is.
Yeah, that's right.
When she's sleeping, you mean?
Yeah, that's right. Yeah.
She is.
Yeah, there you go. So you snore as well? Yeah.
Yes.
So, Georgia, where does your tongue go when you breathe through your mouth? So go like this. Is your tongue at the top or bottom of your mouth?
Bottom.
Exactly. Yep. So that's why we need to get her to become a nose breather rather than a mouth breather, so that we can have the tongue in the right spot. Yeah?
It's not at the very bottom. It's 2 steps up and there it's
Okay. Well, that's good. That makes our job a little bit easier then. So we have to encourage that tongue to be in the top of the mouth, and to get that to happen, we have to first of all correct the breathing. So the way we do that is we do some breathing exercises, some simple breathing exercises, because normally it's just a habitual thing. So we can retrain that mouth breathing to nose breathing. And I can see Georgia is breathing at the moment pretty comfortably through her nose, which means there's probably not a structural defect in the nose, in the bone that's blocking the nose.
That's good.
So we'll do those first. Now, for severe mouth breathers, now I don't think Georgia fits this category, but for severe mouth breathers, we may need to do a more extensive breathing program, which runs for over 4 days, and they're 90-minute sessions at night. So I think they're around 7:30 p.m. And that's just an intensive breathing program if they're very severe. We actually do that in our Rabina practice. So it'll require travel to that Rabina practice if we have to go that way. But as I said, Georgia doesn't look like she fits that category at the moment. And then worst case scenario, that's right. So a worst case scenario, it's very rare that we will have to refer to an ENT specialist to get an assessment of the nasal breathing. But as I said, we should be fine with just the breathing activities and wearing the Myobrace. In terms of the habit correction, as I said, we use the Myobraces there to correct those bad muscular habits. In terms of the arch development, which means developing those jaws, making those jaws wider, we'll just use the tongue and the Myobrace first, give that a go. If we need to, we can use these expanders, this plate.
It's very nice to wear.
You can choose your colour with this actually, but we probably won't need to go that way.
That's good.
If you're good with wearing your Myobrace,
That's good.
And we've got the wire here as well up our sleeve if we need to.
No,
that's right. So if you wear it as you should, we should be able to avoid that in your age. Yeah. And for final alignment, we go on to what we call the T series, which is the one with the 2 slots, and covered in our fees as well is braces if needed at the end. But only 5% of our cases need braces, and that's normally the older age group. So a 6-year-old definitely won't need braces if she's good with her appliance wear. All right, so guys, any questions at all about the treatment itself? Does that make sense to you, Georgia?
Does it stop you from snoring?
It can do. Now, we don't say it treats snoring per se, but a lot of the time the reason why snoring happens is because that lower jaw is too far back. So this allows the lower jaw to come forward, and normally that
Can
helps
they
with snoring.
spit it out while they're sleeping?
That's a very good question. Yes, initially...
Like while they're asleep, they might just...
that's pretty normal for the first couple of weeks.
Yes.
But as they get in their daytime use over that first couple of weeks, then it starts to stay in better.
Yeah.
And if we need to, we also have some breathable tape that we can put over the lips as well. As the muscles get more used to having it in, especially with that daytime use, then it'll stay in better at night after.
That's perfect.
Okay, what I'll do...
So as her teeth fall out and she's wearing the Myobraces, it just naturally trains the teeth to grow.
That's right. As long as that muscular environment is corrected, then the teeth come through straight. Yeah. What I'll do is I'll bring Jules in here and she'll just go through the finances with you, and then we'll take it from there.
Okay.